Doctors and nurses, have any of your patients surprised you with their amount or lack of pain tolerance? I had a patient with an open tib-fib fracture, the bones in the lower leg sticking out and below that it looks like jelly, trying to walk away apparently unaware of how bad his leg was. Of course he was incredibly drunk at the time. Well, it's a good thing you aren't a terrible medic. Wait. Working in a hospital has taught me the downside of abusing painkillers, drugs. Patients constantly come in here with long-term substance abuse issues, and now that they are actually hurt, MVC, broke bones, etc., you can give them enough drugs to put down a horse and they still feel everything. I was a tech in the O when the EMTs brought in an elderly woman with what they said was a sprained ankle. She had slipped while mopping a floor at work and her co-worker had called it in. Turned out she had broken both of the bones in the lower part of her leg, but was sweetly chatting with us. I was impressed as soon as I saw those rays. EMTs had no idea and had splintered her ankle over where her bones were broken. Typically, broken bones in the legs, unless there's a huge amount of angulation displacement, do not cause a ton of pain, unless moved. We see that often in the old people with hip fractures as well. They're usually sitting there still and having no pain, but the second you try to move it, they're in excruciating pain. Same goes with trying to bear weight. A doc, 50-year-old guy with a massive heart attack just lying there chillin'. Ask him his pain level. Deadpan, just a little. 5-year-old boy with both forearm bones fractured and dislocated, playing on iPad with other arm. 60-year-old lady slips, falls, destroys pelvic bone, just wants one Tylenol and scooches out of bed wanting to walk home. After much convincing, she begrudgingly accepted that might not be a great idea. There are some bad butt people out there. Fire medic here. Farmers seem to be tough. One time a guy pulled into the front ramp, got out of his truck and walked up holding his severed forearm in his other arm. Get him in the truck. Take off. Along the way he states he lived down the road and wanted to get to us quickly. When asked why he didn't call 911, he replied, I just cut my arm. I ain't dying. Also had a battle of the bulge vet tell me he didn't need a blanket. It was -7 with wind chill. Not a, but actually a cashier at a fast food place. A woman ordered 2 meals, and since she was a little older, really old actually, I offered to bring her food to the table so she wouldn't have to wait. I get there, and her husband had wads of paper towels stuck all over his arms with electrical tape, and his right hand and part of his face were a mix of blood and second-degree burns. Turned out he was working on his lawnmower, and the engine blew up on him. They stopped for lunch on the way to the hospital for burns, and the metal they couldn't get out. He was acting like it was nothing. Working as an EMT, I got called to a 64-year-old female, slipped in her house, possible sprained ankle. When we got there, the woman is sitting in a chair with her legs stretched out in front of her, but she had long pants and slippers on that covered the entire ankle so I couldn't really see it. When we walked in, she was talking and didn't really seem to be in any pain at all, so I figured this was going to be an easy trip. I kneeled down in front of her to take a closer look, and wasn't I surprised to find that it wasn't just broken, it was fricked right up. I mean, the foot was at a 90-degree angle to the outside, and it was also leaned down so what should have been the side of her foot was facing straight down, and the bone that should have been holding the ankle in place was pushing against the skin on the inside of her ankle so hard that it was about to rip through. I was bewildered at the fact that at that moment she said, "It doesn't hurt, so I hope it isn't broken." But she hardly made a peep on the ride to the hospital. 35 miles. Very bumpy. Come to find out she had multiple sclerosis and that makes people feel pain differently. I was chatting with my physiotherapist one day about pain tolerance and she said that she once had a C addict as a patient whose tolerance was absolute zero. She couldn't even touch him without him perceiving it as painful, let alone stretch or manipulate his body. She said he was a very challenging case. Radiographer here. As a student I met a patient who was a typical little old lady. She came in with far too many shopping bags and walked extremely slowly. She'd been sent by her GP because she'd fallen getting out of the bath a few weeks previous. So we brought her in and took the first image, AP pelvis if you were wondering, and her pelvis was absolutely ruined. Turns out she had slipped and fallen with one leg in and one leg out of the bath and taken the whole fall on her vagina. Not wanting to cause a fuss, this woman had ignored the pain and carried on her life as normal for weeks. Long enough for the fractures to be fairly healed, albeit in a strange way not really resembling a pelvis much anymore. When I was studying nursing, I saw a man who had broken his knee in a motorcycle accident 3 days before. The knee was at least 3 times its normal size. The doctor asked him about the pain and he told him it wasn't that bad. He was mostly annoyed at his family who had taken him to the emergency room. I'm an oncology nurse. My patients have some of the highest pain tolerances I have ever seen. They literally have tumors taking over entire cavities in their bodies. Huge masses pressing on places that aren't supposed to be pressed on and literally eroding through their skin, and they will ask me for pain meds when I have a second. It amazes me. Not a doctor, but my goddaughter was born very prematurely, requiring a major open heart surgery at 2 weeks old. We were told by her docs that since she'd gone through so much surgical trauma the first few weeks of her life, as a neonate, her pain receptors nerve endings would not develop normally. They gave us the example that if she put her hand on a hot stove as a kid, she would have sustained a severe burn before feeling any pain whatsoever. She never cried as a kid when she got shots, fell down, banged into things, even when it was enough to draw blood. I suspect her medical history was the cause. I'm a nurse who used to work in orthopedics. The amount of people who would guzzle oral morphine was unbelievable. Older adults, little old ladies, would just take 2 paracetamol and would be totally fine. My dad has an unusually high pain tolerance. He was cleaning a fishing pole in our backyard once when he didn't notice that the pole had splintered and pulled his hand down on it. The force caused the pole to snap in half and drive itself all the way through his hand. He stood up, walked in the kitchen with pole hanging out of his hand, and calmly asked my mom if he should just pull it out or go to the ER. Since it was a fiberglass one, he opted for the ER, just in case something was broken off inside his hand. The list goes on and gets worse. The other was when he fell off a ladder and shattered his leg. The bone came through the skin and he was bitchy about going to the ER. A doctor here. I can't count on 2 hands the number of patients I have seen that are covered in tattoos and are scared of needles, IVs. I mean, complete phobia. It makes absolutely no sense. If anyone can enlighten me as to how this phenomenon can exist, I'd appreciate it. To quote a friend of a friend, when asked by an doc who queried why he was freaking out over getting a tetanus shot after having a cut sewn up without anesthetic, that's why it's called an irrational fear of needles. A doctor here. My intern year in residency, I saw a 17-year-old kid who, while playing hockey, tried to stop a puck with a gloved hand. It struck his fingertip, injuring the base of his nail, causing a significant deformity. His nail bed needed repair, which requires first removing the nail. That is done by bluntly dissecting, separating the nail from the tissue below it. If your stomach didn't turn red in that and imagining it, congratulations, you have no soul. Typically, we use a numbing agent to eliminate sensation to the entire finger using something called a digital block. I put it in. After 10 minutes, he still felt me touching his fingertip. I tried putting some around the nail. He still felt everything. His mother said his father actually had a similar thing. Lidocaine didn't work on him. I offered him a different numbing medicine. We can inject Benadryl in that case, or even knocking him out. He looked at me in the eyes and said, "Doc, just take it off. Without anything, yeah, it's fine. They fix our cuts without numbing medicine, but it's gonna hurt a lot. I have to scrape, I know." So I went at it. He grabbed a towel with his other hand and I went to work. 45 minutes later, the nail was off. He was repaired, and I replaced the nail in its rightful place. The kid didn't even make a noise. TLDR. Hockey players are freaking badass. Holy frick, I'm ready to puke just reading that. Oh my god. A doc here. 54-year-old guy comes in with a heart attack, keeps telling us he's fine. He looked sick. When we begin switching out the EMT's monitors for our own on his chest, he says, "Don't worry about that, it is my elbow that is the problem." Not 2 seconds after he finished that sentence, He was dead. Luckily we were able to revive him. I kept track of his case while he was upstairs, and he left the hospital alive and without any neurological deficits. Feels good. Nurse here. While in school, I had a 7-year-old girl who had broke her hip by getting bounced off a trampoline. They lived a few hours out of town, and when it happened, they knew she was hurt, but not how bad. So her parents put her in the back of the truck and hauled her for 45+ minutes to their local hospital. She got there, they did x-rays and found it was way too bad for them to treat and that she needed to come to us. They rushed the family out, without anything for pain for this little one. For another hour plus ride to our. This girl didn't shed a tear. She was hands down the toughest patient I've ever had. Had a 19-year-old do the same while skateboarding, and I had to pull him out of the car while another nurse held his leg in place. Some people will amaze you with their strength and braveness. Not a nurse, but a medical technician at a couple of large events in my country. Working at a racing track, I had both of these people come in on the same day. Male, 54 years, Swedish, small cut on hand. His reaction to me pouring water, saline, in his wound. OW. It hurts when you put disinfectant in there. Be careful. Male, 32 years, Finnish, deep cut in right forearm. His humeral bone was visible. No, it doesn't hurt. Now just tape it the frick up so I can get back on my bike. As a Swedish person, I tell you this, do not frick with the Finnish people. Patients in a sickle cell crisis. I've pushed up to 14 mg of Dilaudid, 1-2 mg at a time, into these patients without a resulting change in vital signs or mentation. However, I've also seen young men competing in rodeos who have been stomped by a bull a few times come in with broken ribs and a pneumothorax saying, "It's just a scratch," and declining pain medications. EMT here. I once took a kid, about 18, 19, to the ER screaming all the way for sunburn. Sunburn. I mean, yeah, sunburn isn't fun, but this kid was claiming 9/10 pain and whimpering. I was astounded. Charge nurse and I giggled about it for weeks. A friend told me an old boy came in with a large laceration on his arm. Suturing it up took over an hour, but can be quite fun as you can chat to the patients. My friend was engrossed talking to him about his experiences in the Second World War and really enjoyed treating him. The old chap was in good spirits throughout and told him lots of interesting stories about his time behind enemy lines or in trenches in Flanders. After he put the last stitch in, my friend started clearing up and found the local anesthetic bottle, unopened. He realized he'd not put any local in at all, and yet the guy didn't once flinch, leave aside complain. When asked why, he didn't say anything. He just said, "Oh, I thought that's how it's supposed to feel. I didn't mind. Lovely chatting to you." Then walked out. Don't make them how they used to. You gotta watch those old guys. Anybody of the generation that fought in Korea or World War II will get up and walk on 2 broken ankles for a chest x-ray. Tough guys. I've had a few patients in Tridge swear that their pain was 10/10 while eating, drinking, laughing, playing on cell phone. I'll chart whatever number that they said and then put in the notes. Patient laughing. Insert verb or emotion. I had one nurse that when a patient would say a certain number, she'd hand them a card that would say, at a pain level of 7 you would be sweating. Vital signs would be elevated, you would be nauseated and probably vomiting. Then she'd ask, "You sure you're 7, 9/10 would change their answers. Med seekers and junkies coming down have the same level of pain tolerance. Barely touch the junkies and they flip out due to pain, whereas the med seekers attempt that crap and overact. I saw the guy try to fake a seizure and it was the funniest crap ever. He was curling his hands up like he had CP and leaning his head back to gather spit so he could foam at the mouth. Med seekers will always be allergic to morphine and need Dilaudid and Ativan. I don't think I have met anyone with a high pain tolerance. Some chick came in with cysts on her ovaries and declined meds because she was in recovery, so that is actually pretty bad. But not a doctor, but I went to the ER with my younger brother after a ski accident. My brother fell on his back off quite a big drop, causing his sternum split open. A few runs later he said he was sure something was wrong with his chest, so we eventually got to the ER. The doctor was shocked that he was able to continue skiing after it, and that he wasn't writhing in pain when it was touched. My brother's explanation was, yeah, it hurts, but I can't do anything about it. My friend's dog piled on my chest when I turned 16 and we heard a loud pop. It was my sternum. My chest hurt, but I never went to the doctor. To this day, if I stretch my arms out and take a deep breath, I can pop my sternum like people pop their knuckles. My grandmother wouldn't take pain medicine, not sure why, but even getting dental work done, she didn't want numbing agents. The only time I know that she took pain meds was some aspirin after getting T-boned while driving and hurting her shoulder. She passed away last year from ALS a few weeks before her 80th birthday. She was the most independent person I've ever known, and even having to rely on her kids for help, she didn't complain. The aspirin was probably given to her to reduce the risk of a blood clot DVT. Older people risk having a strong after impact injuries. Not a doctor, but heard a good one from my PCP. He had an older Marine that came in, reason being stiff neck and nausea. Does his normal workup, rules out C-spine injury, decides to test for meningitis, tells the guide to touch his chin at his chest, turn left, turn right, look up, nothing. Tells the guide to stand on his toes and drop onto his heels, and the guy nearly collapses and then vomits on the floor. Doc asks, "Didn't it hurt when you touched your chin to your chest?" Marine replies, "Yes, it freaking hurt, but what does that have to do with it? I'm your doctor. You're supposed to tell me when something is wrong." The Marine just looked at him with a slightly blank look on his face and said, "Oh, sorry doc, won't happen again." When my daughter was 5, she severed her ring finger in a door. I was making lunch for a picnic when she realized her teddy bear was in her room, and you can't have a picnic without a teddy bear. She went upstairs to grab it when I heard a slam and one single blood-curdling scream. Then silence. I ran to see what was the matter, and my little daughter was sitting on the floor in front of her door, covered in blood and staring at something. She looked at me and said, "My finger is off, mama." I wrapped her hand in a towel, picked up her finger and called 911. In the ambulance, the paramedic was asking her questions about how much pain she was in, and she told him that it's the most hurty thing ever, but she was more sad that she ruined Teddy with her blood. They ended up being able to reattach the finger, but her Teddy was ruined. I tried to wash him, but it didn't came clean. The whole upstairs looked like a murder scene. I even washed blood off the ceiling. A few days later, the paramedic knocked at the door with the biggest teddy bear I ever saw. He gave it to my daughter and told her that she was the bravest little girl in the world. It was really sweet. I had a patient, 60-something male, who had 3 of his fingers mostly amputated by a snowblower at about the level of the second knuckle. He came in with his fingers hanging from skin flaps and was totally stoic. Not only was he a 0 out of 10 for pain, his vitals were rock steady, no alteration in heart rate or blood pressure. He kept joking around about it. "Ah, just cut him off, they'll grow back." This guy remained a 0 out of 10 for the entire time, even when they just cut him off. His biggest concern was getting out of the ER in time to watch a football game. Badass mother. Stark contrast to other patients I get who scream bloody murder and cry when the blood pressure cuff is pumped up on their arm. Grown adults. Are you kidding me? Also, screaming and crying is only going to make your BP go up, causing that cuff to squeeze tighter and tighter. A nurse here. There are of course exceptions to the rule, but generally I see elderly with a much higher tolerance to pain than younger patients. An 87-year-old lady can have a fall, break her hip and be resting comfortably barely complaining of pain, but a man in his 20s can come in with the same type of fall and barely be bruised and be writhing off of the bed. Of course it can pain med-seeking behavior, cultural differences in age, or just other people in general, but this seems to be what I see on a daily basis. I broke my wrist when I was 12 after a bad bike crash. I flipped the handlebars and landed on my neck and slid a couple dozen feet. The impact shattered my helmet. Anyway, in the ER, nurses are setting up an IV in the arm that wasn't injured when I explained I landed on my neck and it was hurting. They asked where, so I instinctively used my broken wristed hand to point. Every single person in the room goes ooh and just stops and looked at me, and I guess I was in shock because I kinda just looked around like WTF happened. Eastern European guy had a circular saw accident that cut his leg down through the muscle. The wound was about 8 inches long, was covering trauma surg that night and got called down to sew it up. They had drugged him up and I brought a med student with me and I walked him through aggressively irrigating the wound, reapproximating the muscle and doing a loose suture approximation of the skin. The student took some time and we redid several sutures in the skin and muscle layers because they were too loose tight etc. After about 45 minutes we were done. I asked the attending how much morphine he gave him so I could redose. He replied that he didn't order anything yet and was waiting for me. The patient's last dose was in the ambulance hours ago. I immediately asked the guy how he was feeling while injecting the crap out of him with Local. He said I feel fine. The guy didn't even flinch the entire time we were working. He was connected to a monitor and his heart rate didn't even budge. TLDR, never get into a fight with a Lithuanian man or circular saw. When I was about 12 I fell on black ice and hurt my ankle. I knew it was bad so I asked someone to call me an ambulance. I wasn't crying or anything when they put me in the ambulance. Paramedics told me it's probably just a sprain. I get my x-rays and bam, ankle broken in 3 places and foot dislocated. I saw the paramedic as I was leaving the hospital and he told me he thought it was nothing because I didn't make a peep. I didn't shed a tear about a week late because my leg was hurting. I get to the hospital and the doc says we'll cut your cast off but I don't think we're gonna find anything. He leaves. The nurses take the cast off and my entire leg is green, black, purple, blue and I am pretty sure some new colors that no one has ever seen before. Also had a bunch of pressure blisters. So the doc walks and looks like he's in shock when he sees my leg and then leaves without saying a word. Then a new doc comes in and gave me a cool cast that I could take off to air out and look at my leg. My pain tolerance tends to frick me over. Also frick that doctor. I am a radiographer in an ER. We frequently have to move patients with broken bones to get our pictures. The elderly have a surprisingly high pain tolerance. I've seen elderly patients move limbs with obvious breaks to accommodate our needs without a peep. People with the least pain tolerance seem to be the younger crowd, ranging from 15-30. They whine and wail from the slightest touch. And more often than not, the ones with no breaks whine and scream the most. I've sprained and broken a few limbs in my lifetime. To be fair, the sprains far and away hurt worse than the breaks. Like spraining my ankle hurt a heck of a lot worse than when I fractured 3 ribs and a wrist all at once. Not a doctor but I recently broke my femur. When it happened, the first 30 seconds was the most intense pain. After that I was calm, not in much pain, and joking and such. The only nothings that hurt that could get really any reaction was moving me from stretcher to bed, then x-ray table, and then the worst but relieving pain. They put a boot made out of soft stuff on my leg, and then they pulled. My bones were overlapped by 3 inches. Until the bones were a little more lined up. Then they put a weight on the end. But during that time the nurse lady saw my face in a grunting face I guess, and she said you can cry and scream if you want. I just shook my head. My mom recently had a heart attack so I didn't want to scare her. That's actually really sweet. Not a doctor or nurse but this happened to me. I completely shattered my knee and part of my leg after I was running and slipped on some ice into a stone wall. I was with a group of friends and all they saw was me slide and hit the wall. They came over and asked if I was okay. In a normal voice I said I couldn't move my leg. No tears, screaming or anything. No one believed me but after a minute or 2 I convinced them to call 911. The whole time I was waiting for ambulance, about 30 minutes, I was talking to them normally and no one believed I was actually hurt until I started going in and out of consciousness. Right as the paramedics got there I started to wake up. They got out and they didn't think anything was wrong until they cut my pants off and saw my femur was almost protruding out of my leg. I had no kneecap and tops of the tibia and fibula were protruding out. They took me to hospital, no drugs in the ambulance, as I was joking around with them that is, asking if I'm allergic to anything. I told the apparently stone walls. They got me to hospital and rushed me into it. The doctors came over and were shocked I wasn't screaming or crying. Then about an hour after the initial injury the pain finally started and once they started moving the leg about 3 doses of morphine, because one wasn't enough and one of Demerol. I don't remember the next couple days besides bits and pieces, but all the nurses and doctors told me I had one of the highest pain tolerances they have seen. Although I imagine it wasn't really my choice, mostly the brain just shutting it down because I was in so much shock and had so much trauma. You're really lucky that an artery wasn't severed. Not an a doc or nurse, but I work side by side with a doctor. I saw an 8-year-old boy come in with a compound fracture to his left humerus, upper arm. First thing I noticed was him strolling in, not a tear or grimace on his face, blood pouring down his arm and a bloody rag held down near his elbow. First thing I thought was he probably had a decent laceration to his arm. Pretty tough, but nothing too impressive. I get into the room and see that the rag was removed, and holy crap, that's a bone sticking out of his arm. How the heck is this kid not bullying? And how the heck did he just walk into the air, barely cradling his arm? Right then I knew this kid was tough. Little did I know that he was about to become Superman. So, I'm sitting there admiring this gruesome wound and listening to his backstory. Apparently the kid was out with a friend riding a 4-wheeler when they accidentally drove into a ditch and flipped the vehicle. Kid was thrown and the quad rolled over his arm. This was about 4 miles out in the middle of nowhere over bumpy dirt trails. So of course he just jumps on the quad and rides the 4 miles back to his house with a bone sticking from his arm. Then has his dad just leisurely drives him the 30 minutes into town to the hospital and strolls on in. Best part, when the doctor said that they needed an x-ray of the arm, he just casually asks, "Before you move it, can I get a little pain medication? It sorta hurts." Most badass 8-year-old I have ever seen. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.